I'm up here with Dr. Samantha Heywood. I am an obstetrician gynecologist and maternal fetal medicine specialist and an assistant professor of obstetrics and gynecology at Indiana University. I am here on behalf of the Indiana section of the American College of OBGYN and on behalf of myself. I am here to provide information that I hope will be helpful to you as you discuss COVID vaccination exemptions. It was posited earlier that there are no experts in this situation, but I respectfully disagree. I have the qualifications to give you advice because my specialty is caring for high-risk pregnant patients. I am further qualified to speak about this because I have personal experience caring for pregnant patients suffering from COVID. I am here to give medical advice since the question of medical exemption from vaccination is a medical question. Including pregnancy or the intention to become pregnant as reasons for exemption from COVID vaccination is medically unsound and dangerous. ACOG states that vaccine exemptions should be granted only when the medical contraindications exist that would compromise a patient's health. Pregnancy is quite the opposite. Not receiving a COVID vaccination compromises the health not only of the patient, but also of her pregnancy and future baby. We have strong medical evidence from tens of thousands of pregnant patients showing that the vaccine is both safe and effective. We have data from thousands of men and women who received the vaccine while contemplating pregnancy that shows there is no association between the COVID vaccine and pregnancy implantation, early pregnancy development, or infertility. We also have strong data on the risks of COVID infection in pregnant individuals. They are 22 times more likely to die of COVID than non-pregnant people. Counseling a patient with severe COVID about the need for sedation, intubation, and possibly delivery, which are necessary to help her breathing, but from which she may never wake up to meet her baby, is a particular type of hellish experience that is ongoing for us in this field. I am not alone in saying that I am tired, and I am angry that I keep having to do this over and over again because of a problem that is preventable. The language contained in the bill draft providing medical exemptions for pregnant people or those trying to become pregnant is exactly the type of misinformation directly leading people to avoid getting vaccinated, thus putting themselves and their babies at risk of COVID-19 and death. They are 1.5 times more likely to deliver their baby preterm, which carries risk of developmental and physical disabilities, neonatal intensive care unit admission, and neonatal death. Evidence shows that people with COVID infection during pregnancy have twice the risk of stillbirth compared to those without COVID infection. Including these categories as medical exemptions may lead people to believe that vaccination is unsafe for people who are pregnant or who want to become pregnant, when the evidence shows exactly the opposite. The state of Indiana intends to place such emphasis on maternal and child health. Pregnancy exemptions for COVID vaccines runs directly counter to that. The vaccine does not negatively affect fertility. It does not negatively affect pregnancy. Lack of vaccination leads to higher rates of maternal and infant death. Including pregnancy or the intention to become pregnant as exemptions is misleading and disingenuous. If you choose not to listen to the medical experts here who are providing you with the best information about the safety and effectiveness of COVID vaccination, you'll be prioritizing politics over your constituents' health. As a medical professional, I strongly urge you to remove pregnancy and the intention to become pregnant from the list of exemptions.
Questions for Dr. Rouse? Senator Taylor.
Thank you, Mr. Chairman. Doctor, thank you for your testimony. Can you explain to me why you believe that putting this language in there will actually deter women who are pregnant or anticipating becoming pregnant from getting the vaccine?
I think it implies that there are complications to be expected from vaccination that would adversely affect their pregnancy or their intention to become pregnant. And all the data we have argues to the contrary.
Okay, thank you.
Other questions for Dr. Rouse? Thank you for your testimony. Dr. Heywood, is that correct? Okay. And on deck, we have Dr. Scott, Emily Scott.
My name is Dr. Samantha Heywood. I'm a resident obstetrician gynecologist training at Indiana University. I'm here on behalf of the Indiana section of the American College of Obstetricians and Gynecologists and on behalf of myself, a resident physician who cares for pregnant women with COVID and a new mom who was pregnant and gave birth during the pandemic. I'm here to urge you to remove pregnancy and the intention to become pregnant from the bill as reasons for exemption from employer vaccine mandates. This is medically unsound and sends the message to pregnant people and those that intend to become pregnant that the vaccine is dangerous when the opposite is true. Indiana has a physicians shortage that is growing. One of the most effective tools we have to recruit physicians is to train them here and show them what a wonderful place this is to live, to plant roots, and to raise a family. Being in training over these past 2 years has been, in a word, exhausting. Training in the state with the 6th lowest rate of vaccination is demoralizing. I am tired of consenting another COVID patient for an emergency C-section because she cannot get enough oxygen to her baby. My anesthesia colleagues are tired of intubating yet another pregnant patient and telling her she may never get off the ventilator. My critical care colleagues are tired of managing yet another pregnant patient, knowing that her odds of survival are 22 times worse. My pediatric colleagues are tired of admitting yet another preterm infant to the NICU, an infant that will not see or be held by her mother in their first weeks of life, or maybe ever. And we are angry because this is preventable. Over 96% of physicians in this country are vaccinated against COVID-19 because we know that this is the most effective tool against the virus for ourselves and for our communities. I received the COVID vaccine during my pregnancy, and I know that it is protecting me as I return to caring for COVID patients. It is also protecting my baby, who will be going to daycare in a county where only 51% of people are vaccinated. As we end our training and look for jobs amidst this ongoing pandemic, we are looking for places that value our safety and our expertise. We do not want to work in places where we have to battle our own government when giving patients medical advice. We do not want to work in places where the pandemic continues to surge because of low vaccination rates. We are tired, and we will leave the state if we can find safer places for ourselves and for our families. Please value the expertise of our doctors, remove pregnancy and the intention to become pregnant as medical exemptions from vaccine mandates.
Questions for Dr. Heywood? Senator Charbonneau.
Thank you, Mr. Chairman. Just real quickly, I want to make sure I understand what you're saying. First of all, I understand remove the language. But then you go on to say, are you looking for the state to mandate vaccines?
I'm looking for the state to allow employers to mandate vaccines so that physicians who desire to work...
I'm sorry, I couldn't hear the beginning.
Sorry. I'm looking for the state to allow employers to mandate vaccines so that physicians can choose jobs in workplaces where their colleagues are vaccinated.
Oh, all right. When you talk about moving to another state...
Yes, there are other states nearby that allow their hospitals to mandate vaccines, meaning that physicians could work in hospitals where all of their colleagues are vaccinated, which protects them and protects their patients.
Okay, so you're looking for a mandate.
I'm looking for employers to be allowed to mandate vaccines, yes.
Thank you.
Senator Lannon.
I just want to make sure I heard your testimony correct. Did you say Indiana is the 6th lowest in rates of vaccination? Is that in the nation?
Yes, when looking at the percentage of people that have had at least one dose, we are 6th worst in the nation.
Right. And does that, it's minor, but does that include Puerto Rico, which I understand has the highest rate of vaccination?
I believe
over 70%, 71% or 70%.
I believe this is 50 states and D.C. on that.
We're doing worse than Puerto Rico and Kentucky and a whole bunch of other states, right?
Yeah.
Thank you.
Senator Taylor.
Thank you. Thank you, Mr. Chairman. I'm going to follow up to the question that was asked you by Senator Charbonneau. When you say that you want employers, you're not saying you're for mandates for everybody. You're saying for employers to be able to mandate their employees to be vaccinated, to create a safe work environment?
Yes.
Okay. And the work environment that you're talking about is, for you, is a hospital.
Yes.
And you've treated women who have come in pregnant with COVID-19.
Yes, many times.
I have no more questions.
Representative Austin.
Thank you, Mr. Chairman. Could either of you tell me what ACOG's position is? First of all, would you tell the public what ACOG is?
ACOG is the American College of OBGYN. It's our professional society.
Okay. And does ACOG have a position on vaccines?
ACOG strongly supports vaccination of those contemplating pregnancy who are currently pregnant and postpartum.
Okay, thank you.
Senator Melton.
Thank you, Mr. Chair. And thank you both for your testimony, and thank you for what you do every day. My question is, earlier you mentioned misinformation in terms of throughout the pandemic. Do you feel that this piece of, this language will contribute to that?
Yes.
How so?
By including pregnancy and the intention to become pregnant as an exemption, this implies that it has the same associated risks as other medical exemptions. For example, allergy to vaccines, that's a legitimate medical exemption. It implies that there are risks associated with that. And the information that we have shows that COVID vaccination for those contemplating pregnancy who are currently pregnant, postpartum, and breastfeeding is safe.
All right. Thank you. Do you feel that the discussion that we're having today, will this contribute to more individuals not wanting to take the vaccine, just having this debate? Just curious.
Yes.
All right. Thank you.
Other questions from committee? Representative Nagel.
Thank you both for your testimony today. There was one statistic you said, I just wanted you to repeat it. It had to do with, I think you said 22% more likely.
Pregnant patients with COVID are 22 times more likely to die than their non-pregnant counterparts.
Okay, thank you.
Any other questions? Thank you, doctors, for your testimony.